Hey everyone, welcome back to the channel. Today I'm diving into a topic that's super important for anyone interested in health, understanding how diabetes is diagnosed. So let's get right into it. When it comes to diagnosing diabetes, the American Diabetes Association, ADA, has laid out 4 key criteria. First up, we have the fasting plasma glucose test, or FPG. If your fasting plasma glucose level is 126 milligrams per deciliter, mg/dl, or higher, that's a red flag. Remember, you need to fast for at least 8 hours before this test, usually overnight. Next, there's the oral glucose tolerance test, aka OGTT. You fast from midnight, then drink a glucose solution first thing in the morning. 2 hours later, if your plasma glucose level hits 200 mg/dl or more, that's another indicator. Just a quick note, for the 3 days leading up to the test, you should be consuming about 150-200 grams of carbs each day. Alright, moving on to the third criterion, the HbA1c test. This measures your average blood sugar levels over the past 2 to 3 months. If your HbA1c is 6.5% or higher, you might have diabetes. But make sure this test is done in a lab that meets international standards. Lastly, there's the random plasma glucose test. If you have symptoms of hyperglycemia, like excessive thirst, frequent urination, hunger or unexplained weight loss, and your random plasma glucose level is 200 mg/dl or more, that's also a strong sign. If you don't have these classic symptoms, it's recommended to repeat the test to confirm the diagnosis. Now let's talk about a condition that's often a precursor to diabetes: prediabetes. Prediabetes is diagnosed when one of 3 things happens. First, impaired fasting glucose, IFG. That's when your fasting plasma glucose is between 100 and 125 mg/dl. Second, impaired glucose tolerance, IGT. Your plasma glucose is between 140 and 199 mg/dl 2 hours after the OGTT. Third, if your HbA1c is between 5.7% and 6.4%, that's another indicator. These numbers don't quite hit the threshold for diabetes, but they're still something to watch out for. Prediabetes puts you at risk for developing macrovascular complications, which are the big complications associated with diabetes. In Vietnam, a practical approach to diagnosing diabetes is using the fasting plasma glucose test twice. If both readings are 126 mg/dl or higher, it's a strong indication. Alternatively, if you have access to an internationally standardized lab, you can rely on 2 HbA1c readings. So, there you have it. Understanding these criteria can help you stay on top of your health and catch any potential issues early. If you found this video helpful, don't forget to like, subscribe, and share it with your friends. Stay healthy and see you next time.